Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist. And is it possible that the Piriformis Syndrome Pain that you've been diagnosed with or told that you have, and you've been getting lots of different treatments, deep tissue massage of the buttock, lots of stretching, lots of strengthening, dry needling, shots, maybe even surgery, is not actually due to a problem in your butt? Instead, it's caused by a sensitive central nervous system. We call this central sensitization, whereby your brain makes a little bit of a mistake. It sets off the alarm system. The smoke detectors are going off, but there is no fire, the fire being a problem in your buttock. And after reviewing thousands of cases, I found that about 50% of the people who come to me, because this is my specialty, we work with people all around the world dealing with these problems, have symptoms that they feel and think are really caused by a structural issue in the body, piriformis syndrome, sciatica, herniated disc, something like that, but it's actually caused by their brain. And the reason that this matters is because the treatment is going to vary slightly in the way that we approach solving it. Now, a quick disclaimer here before I get too far into this. This is not to say that it's all in your head in the sense of you are crazy, you are making this up, it's not real. Because you feel it, it's very real. This does not mean that this is fabricated or anything is wrong with you. In fact, it probably means that you're very smart and you have a very good brain that's trying to protect you from some perceived, not actual, threat or danger. And so in this video, I'm going to outline 13 sort of telltale signs or indicators that I look for and listen for when I'm working with people, such that I can start to put together the piece of the puzzle and determine if somebody's pain is most likely caused by their brain or their body. And so this video is perfect for you if you've tried lots of stuff aimed at fixing the physical body and it's just not working. You feel like you're banging your head against the wall and you're open to a different approach. By the way, if you're interested in determining the most likely source of your symptoms outside of this video, be sure to download my Better Than an MRI DIY diagnostic guide where I outline my entire decision-making framework for you for free. All right, so let's dive into the 13 indicators that point to it being more of the mind than the body, the pain in the butt, that is. And as we go throughout this, just put a check mark next to any of those that apply, or leave me a comment below at the end of this and let me know how many of the 13 things that I'm about to share here did you resonate with? Did really ring true for you? And in my experience, I'm going to suggest that if you have just 5 of these 13 signs that I'm about to share, that this indicates the symptoms are more of the mind than the body. All right, so let's dive into it. The first indicator or sign is that you have no clear injury, or you cannot recall a specific time where you injured yourself, which tells me you probably didn't injure yourself. If you can't remember hurting yourself, it probably didn't happen. And so what happens is people come up with what we call perceived injuries, not real injuries. Because our brain is a problem-solving machine, what happens is we try to justify why we hurt and come up with different reasons, even if it doesn't really make a lot of sense. Let me give you an example of a perceived injury. Dr. Charlie, I just started having buttock pain a few weeks ago, a few months ago, and I think, notice the I think, or I feel that finally all the years of poor posture and sitting at my desk are catching up to me, and that's why I hurt now. Well, that's interesting because how many people, right, have been sitting for years and have years where they don't hurt? How many times have you seen someone sitting at their cubicle doing work and they scream out in pain? Not many. And so I'm not sure sitting has really ever damaged anyone, but we like to place blame on this as a cause of why we might hurt. Another example would be, hey, when I was younger, growing up, I was really hard on my body. I played a lot of sports and I beat myself up. If you had an injury many, many years ago, even if you did beat yourself up pretty good, it would have been healed by now. It would not be the likely explanation for why you hurt. Hey, Dr. Charlie, I broke my tailbone. I broke a bone when I was younger, and that's why I have these problems. Hey, Dr. Charlie, I think or I feel it's because I started to run a little bit more or lift weights a little bit more. And so if I were to ask you, do you ever recall a specific moment in time where you can say, that's when I injured myself? And you say no, then you must put a check mark next to this. You cannot recall a specific injury, therefore did an injury actually happen? And is the pain due to some damage in the body if you can't ever remember damaging it? All right, indicator number 2, your pain has been present for more than 6 months. You're starting to experience what we call chronic pain. And why is this an indicator that symptoms are more of the mind than of the body? Because almost everything that has been structurally damaged in the body heals. A cut heals, a bruise heals. If you break a bone, then the natural healing times for bone healing, for example, would be somewhere between 2 to 3 months. All right. If you injure a muscle, for example, the piriformis muscle, we generally see it takes about 4 to 12 weeks to resolve that pain as well. If you herniate a disc, you will see that majority of people are better at 6 months to maybe 9 months if we want to push the timeline a little bit. And so Why is it that all of these structures in the body, you could experience the worst bone break and you would see that it heals in a few months' time, but you've been dealing with this inflammation in this muscle for 6 or more months now? You see how it doesn't really make sense. It defies natural healing times and physiology. Something else to consider is that my guess is while you've been experiencing this buttock pain, you've had other bumps and bruises. You've maybe nicked your finger, you potentially bumped into something and you've had a bruise, some type of damage or injury to the tissue in the body. And if that's gotten better, then did your body just say all of a sudden, hey, you know what, we're gonna heal all the other injuries and aches and pains and problems, but we're just not going to heal the piriformis? You see how it doesn't really make a whole lot of sense. So if you've had symptoms for greater than 6 months, again, this is a sign or an indicator that symptoms are more psychological than physiological, or a problem more with the mind than the body. The third indicator, okay? Doctors cannot agree upon the source of your pain or why you hurt. This generally means that you've been given many different diagnoses. So bursitis, tendinitis, arthritis, degenerative disc disease, piriformis syndrome, hamstring tendinitis. I could probably go on and on. And so if you've been told many different causes or been given many different diagnoses, then this in and of itself proves that nobody really knows the cause of pain because they can't agree upon it. Now this goes also for reasons why or explanations for why you hurt beyond just the medical diagnoses. So maybe you've gone to a chiropractor, a PT, and a massage therapist, and they can't agree either. So maybe you come to someone like myself, a PT, and they say, hey, it's because your core is weak or your pelvis is out of alignment. Maybe you go to see a chiropractor, and it's because your one leg is longer than the other. When you go to see the massage therapist, of course, they say, hey, it's because you have trigger points or tightness. That's just what they do. The only tool you have is a hammer. Everything's a nail, folks. Maybe you have that experience. And so if you've been given many reasons why you hurt, then that is something you're going to say, hey, this applies to me. People can't really agree upon why I hurt. Or maybe you've been given the straight up explanation of, well, hey, we've done x-rays, we've done MRIs. Yeah, you've got some stuff on there, but it doesn't explain why you hurt. We don't really see anything significant there. And so we really don't know what's causing your problem. And if that's the case, again, put a check mark next to this third indicator. Number 4, do symptoms skip or shift or jump around without known cause or clear reason? So maybe, as an example, you have pain in your right butt cheek and down your right leg. But then some days it just goes to the left leg and you're not really sure why. And then it goes from the left leg back to the right leg. And you see how this doesn't really make a lot of sense. If I were to damage a tendon in my shoulder, it's going to be very precise as far as where it hurts and the location of symptoms. It's not going to, if I damage the right shoulder, I'm not going to say, hey, my right shoulder hurts now, and then the next day, now my left shoulder hurts, even though that's not the one I damaged. And then it's back to my right shoulder. If you damage the piriformis, if you irritate the sciatic nerve, let's just say on the right side of your body or in your right butt cheek, then you will feel symptoms on the right side of your body. It will not all of a sudden then jump to the other side, and naturally the right side is healed, now the left side is the problem, and vice versa. You see how that doesn't really make a lot of sense? It's inconsistent with a problem that is structural in the body. So not piriformis syndrome if this is the case, instead most likely centrally driven by the mind. The fifth telltale sign is that you have other symptoms that are present elsewhere in the body. So even though you might say, yeah, I've got a pain in my butt and I've got sciatica, let's not get too zoomed in on that. Do you also have chronic neck symptoms or shoulder symptoms or knee pain? Do you have GI complaints such as maybe irritable bowel syndrome, stomach aches or pains? Do you have headaches or migraines? And everybody up to this point has viewed them as separate problems. You go to the hip doctor, it's a hip issue. You go to the headache specialist, it's a headache problem, right? You go to the back doctor, it's a back problem. But is it possible that all of these symptoms are actually driven by one thing? And that one thing being the nervous system, the central nervous system. What are the chances that you have not only a back problem and a belly problem and a knee problem and a neck problem, and you have all these different issues that aren't responsive to traditional treatments, and that your body is that broken? Not very high, all right? So again, it's much more likely that one thing is causing it. Usually that's the mind, and so you would put a check mark next to this if you have multiple other symptoms within the body. Number 6, there's a correlation between stress and symptoms. More stress, more symptoms, less symptoms. And by the way, this could be good stress or bad stress if you want to define it as that. So good stress, I just had somebody reach out to me and say, Dr. Charlie, stress is not related to my symptoms at all. We, in fact, had the best time of our lives. We just got married. We just had a new baby, right? We just started our jobs. Well, all of those things are generally fairly strong stressors or periods of change for most people, which tends to put us in a fix it, figure it out, problem solving, trying to adapt mode, a little bit of survival mode, fight or flight, which can upregulate symptoms, make your nervous system more sensitive, and place you in a space or a state where you're more prone to symptoms physically in the body. So that's good stress. What about bad stress? Maybe a financial stress, maybe a divorce, maybe someone died or passed away that you were close to, a dog, a friend, a family member, something like that. These are examples of maybe not so good stressors, right, that can also sensitize the system. And so do you notice that when stress is more high, symptoms go up, and when stress is less, symptoms go down? If so, put a check mark next to this. Number 7, sort of along the same lines. Distraction makes you feel better. So pain is a great preoccupier. It's fueled by attention and fear and focus. Well, what happens when you go on vacation? What happens when you go out and you have a girls' night with the friends, right? Guys' night out, girls' night out. What happens when you go out to dinner with your neighbors or with someone that you enjoy company with? What happens when you're playing video games or getting lost in something, maybe like a creative project? Do you notice that your symptoms lessen? Because you're starving the pain of the normal focus and attention and fear, and you're directing it elsewhere to something that you're authentically enjoying. If you've noticed this happen, you may have written it off as, well, I was on vacation, so I wasn't sitting at my desk all day. You could do that. But let's look at all the signs, and I'm telling you, this is an indicator that symptoms might be more psychological than physical. So if you notice distraction makes you feel better, put a check mark. The 8th indicator or telltale sign is that you have good days and bad days for unknown reason. So maybe you have a routine Monday through Friday, and you notice that without changing much of the physical routine throughout the day, that some days you wake up and you hurt, and other days you wake up and you don't hurt, and you're not really sure why, because you slept on the same bed, you went to bed at the same time, you slept pretty much in the same positions. You see how the mechanical or physical inputs didn't change there, but it's possible the psychological ones, your thoughts, feelings, beliefs, worries, concerns did, and could that be driving the symptom experience? So do you have good and bad days, and you're not sure why? Put a check mark next to that. Number 9, do you have trouble finding yucky emotions or emotions that reproduce your symptoms, but yet you have yucky activities or positions? So the reason that this is an indicator of something that's more psychological than physical is because a physical problem is very clearly reproducible. Again, just for sake of you being able to see me, if I have a torn shoulder tendon, rotator cuff tendon, I will consistently be able to increase the pain in my shoulder by trying to, say, lift my arm above my head. It doesn't decide in the morning that it wants to work well, and then a couple minutes later it doesn't, and day to day I can do it fine one time, and then the next time I can't. Tendons and structures like muscles and bones, they don't repair or change that rapidly. And so if you're having moment to moment, day to day, times where you do a motion, it hurts one moment, but then the next moment it doesn't hurt, or maybe you've gone to see a physician or a specialist and they bring you through a movement exam and you're like, I just have a hard time doing any of these moves because none of them really recreate the pain that I experience. And this tells me that you can move your body and stress the tissue in the buttock in many different ways, and it's able to tolerate it, meaning it's likely totally fine. If it were damaged, you should be able to pull on it, stretch it, contract it, do something to it to reproduce the problem consistently. Now, the second part of this, not only is it hard to find yucky emotions that clearly reproduce the problem, but you're still here because you have pain, right? So you probably have pain sitting or maybe sleeping or laying down or driving or doing something like that. So you can do all these different motions. Life is motion. But you can't do those activities which involve those motions, right? So imagine I said to you, hey, I can kick my leg back and kick my leg forward and twist this way and twist that way and hop on one foot and hop on the other foot. I can do all those individual motions, but when I put it together collectively and it becomes running, I just can't run. That's weird, right? Hey, I can do a knee to chest. I can do a figure 4 and try to tie my shoes and put on my socks and cut my toenails, and I can bend forward and this way and that way, and it's not a problem, but I just can't sit. You see how that doesn't really make a lot of sense either. So if you have trouble finding clear, consistent, yucky motions that reproduce your symptoms, but you still are here because you have pain with certain activities or positions, then it's possible you've trained yourself, not intentionally, to experience symptoms with those activities. You started to correlate sitting or driving or walking with pain and you've actually learned that. Number 10, sitting on a soft surface makes you feel better. Why is this an indicator that symptoms are maybe more of the mind than the body? Because research shows that when you sit on a soft surface, you actually have more compression of the glutes, of the piriformis area, of the sciatic nerve. And so if your theory is that the reason I hurt is because my piriformis is inflamed, my muscle is irritated, my sciatic nerve is compressed, but sitting on a soft surface results in more compression or causes more compression compared to sitting on a hard surface, then this kind of contradicts that theory. We actually see that sitting on a hard surface in most cases reduces the stress to the glute muscles and shifts the load to the sit bones, to the bones of the buttock where the hamstrings attach. So it removes stress off the piriformis and the sciatic nerve area and shifts it to the hamstring. So if sitting on a soft surface makes it feel better, put a check mark next to that. Number 11, delayed onset of pain or symptoms, meaning you don't feel pain while you're doing things, but you feel it later. So maybe you get treatment or you do an exercise, or maybe you've gone through some motions while watching this video to see if you could find any yucky motions. And you're like, hey, it didn't hurt at all while I was doing it, but now I'm starting to flare up. No pain now, pain later. This goes against the structural source of symptoms, because if I whack my finger now and I truly damage the tissue, right, the brain goes, hey, something's happening down in the skin, and it is going to cause immediate symptoms. It's going to cause immediate reaction. Stimulus, hammer, reaction, pain. Withdrawal finger, ouch, inflammatory process starts because you're probably bleeding at that point. So if damage occurs, you will feel pain in the moment that that damage occurs, and then maybe later too. But nobody hits their finger with a hammer and says, well, I didn't feel any pain while I hit my finger with a hammer. It wasn't until 3 hours later when I screamed out in pain. All right? If you break a bone, you know you break it in the moment. If you hit your finger with a hammer, you know you did something in the moment, and then you probably feel symptoms later. Versus, if you do not feel symptoms while you're doing a stretch or doing an exercise or getting a treatment, then what are the chances that it actually damaged anything in your body and your body just decided not to set off the bells and whistles, not let you know? Not high. That wouldn't happen, right? And so that is a sign, delayed onset of symptoms, no pain while you're doing it, but pain later. The symptoms are more of the mind than the body. Number 12, if you're watching this and you've tried many treatments aimed at fixing the physical body, all the rotations of the pelvis that you've been told are the problem, all of the imbalances within your hips, all of the core weakness, all of the leg length problems, you've tried orthotics, you've tried shots, you've tried maybe even surgery, and all these things, looking at the body through a microscope and looking at the piriformis as the problem, and you've tried to fix it that way and nothing has worked, then at some point you start to ask yourself, well, is it possible that the cause of symptoms is not actually where I'm feeling the symptoms? Is it possible something else is causing the problem because nothing I'm doing to fix it is working? Right? If a mechanic hears a squeak and they say, well, hey, I believe that it's caused by the brakes, but they fix the brakes over and over and over and over again. Before you know it, you've got completely new brakes, but you still hear the squeak. What does that tell you? They thought it was the brakes that were squeaking, but it's not the brakes because they fully repaired them. If it were the brakes, the squeak would have gone away. And so if you're trying to fix the physical body, but things are still squeaking, your alarm system is still causing pain, well then is it possible that it's more centrally driven instead of a problem in your butt where you've been focusing all along? And number 13, do you have a type A, good student, I'll do whatever it takes, Charlie, whatever you tell me to do to solve this problem personality, often high pressure, high hypervigilance, high focus, probably very good at your career, probably successful as a parent and in what you do day to day. But when it comes to trying to get out of pain, this puts us in a state of more fight or flight, which can increase the perceived danger to the nervous system and can fuel pain that we experience, even if it's in the butt. All right, so there you have it. The 13 indicators. Again, if you just put 5 little check marks next to 5 of those 13 things, then you might want to consider that your symptoms are more centrally driven, caused by central sensitization, instead of caused by actual piriformis syndrome, which maybe you've been told that you have, right? So here they are real quick. No clear injury, or you're coming up with injuries. We call these perceived injuries. They're not real injuries, all right? Number 2, pain greater than 6 months. Number 3, doctors can't really agree upon the cause of your pain. You've been told many things or nothing. X-rays, MRIs are fairly inconclusive. Number 4, symptoms shift or jump around for no rhyme or reason, maybe from one side to the other. Number 5, you have other symptoms elsewhere in the body, irritable bowel, stomach, belly pains, migraines, neck pains, shoulder pains, lots of different things there. Number 6, you notice a correlation between stress and symptoms. More stress, more symptoms, less symptoms. It could be good or bad. Number 7, distraction makes you feel better. Pain is a great preoccupier. When I'm preoccupied with something else, I feel better. Put a check mark next to that if that's you. 8, good days, bad days without really changing much of what you're doing physically. All right. Number 9, no yucky motions, hard to clearly and consistently reproduce the pain in your butt, in your leg, but you just can't sit, you just can't drive. You've got yucky positions and activities, and that's why you're here. Number 10, sitting on a soft surface makes it better. Number 11, delayed pain in your butt, back, or leg. When I do something I don't feel it, later I do. Number 12, treatment aimed at fixing the physical body is not working. It's not working for a reason. No pattern is the pattern. No response is telling you what you will respond to, all right? Number 13, type A, good student, get her done, high pressure, perfectionist personality. Let me know in the comments how many applied to you, and are you now a little bit more open-minded to the possibility, even though you feel pain in the butt and it's very real, you're not making it up, that maybe it's not caused by a problem in the butt. Maybe it's not piriformis syndrome after all. If so, the first step is just what we did, to shift your belief system and open your eyes to the possibility of, wow, this really resonates with me and this sort of makes sense. No wonder everything I'm doing isn't working. Once we shift your beliefs, we can change your actions, which can get you the results that you're looking for. So if you're interested in learning how to become pain-free using the power of your mind and movement as medicine, go ahead, click the link below to apply to work with us. I would be your coach, and I would love to review your case personally to see if/how we can help. Click the link below, follow instructions to set up a time to chat with us, and then follow instructions to submit a formal case review. Thanks so much, everyone. Chat soon.